Hello there, my name is Mr. Pulse. Today, we're going to talk about congenital heart disease, or CHD. First of all, what is CHD? CHD involves problems with a child's heart, relating to problems with the heart structure and function. It can involve the heart's many vessels, valves, and walls, which as a result disrupts the normal flow of blood throughout the heart. Okay, but how do doctors find out that a child has CHD? Doctors use a variety of imaging techniques. They mainly use echocardiogram, chest X-ray, MRI, and cardiac catheterization. So what is an echocardiogram? It is a painless test that uses sound waves, ultrasound, to produce moving images of the heart. It creates almost like a video of your heart working, so that the doctor can see whether it is functioning properly or not. But is it safe? It uses no radiation, so it's incredibly safe. So how do you prepare for this scan? Patients usually do not need to prepare in any way for the test. You can eat and drink as normal and take your normal medication, unless your doctor instructs you otherwise. And what happens during an echocardiogram? The scan can either be done in a hospital or a doctor's surgery. The test usually takes less than an hour to carry out. A patient will be asked to remove their clothes from the waist up and to lie on a table. The doctor will apply soft, sticky patches called electrodes, as well as a special gel to your chest. Although the gel is harmless, it's freezing cold. An ultrasound probe will then show a live image of your heart beating. Most of the time, patients are able to return immediately to their normal task once the procedure is done. And what's a chest X-ray? A chest X-ray is a picture of the chest cavity obtained using X-rays. Although it's usually the first port of call in examining the heart, it does not show detail of the heart's internal structures. How should one prepare for a chest X-ray? There is little preparation necessary. Tell the technician if you are pregnant, as X-rays are usually avoided in cases of pregnancy to prevent radiation exposure to the fetus. If scanning your child, ensure they're not wearing any jewellery and practice holding their breath with them, as they may be asked to do this briefly during the scan. Are X-rays safe? The major risk is radiation exposure. However, chest X-rays involve a small amount of radiation, so the risk is far outweighed by the potential benefit of getting the scan. What is cardiac catheterization? This examines how the heart is working by inserting a tube called a catheter into the main vein emerging from the heart, the vena cava. Although this sounds scary and painful, it's usually painless but may be slightly uncomfortable. The procedure may take an hour or so, as the doctor will examine all the heart structures for defects, e.g. testing the opening and closing efficiency of the valves, or the heart's ability to contract. Lastly, talk to me about MRI. This is an imaging technique that uses magnetic field and radio waves to form a detailed image of the patient's internal anatomy. It uses no radiation and is completely safe. You may have heard some scary rumors about MRI. What you've heard may be exaggerated or untrue. So, what happens in an MRI then? Patients must remove all metal artifacts. Patients lie down on the table and may be covered on the chest with a brace to help examine the heart. The table moves the patient in and out of the donut-like open-ended MRI machine for 30 to 60 minutes. The machine will be very noisy. Patients have a two-way communication system with the operator and may be able to listen to music. Babies are usually sedated to avoid movement, but the sedation will wear off fully in a number of hours.